what is the importance of Ayurveda and why do you think that one should know about it so intensively?
Ayurveda, we should know about it for several reasons. One, it has been with us in India as the major practice of medicine for thousands of years. At least from Buddha's time, it has been in practice here. It is still being used by millions of Indians. According to some health ministry figures, 70% of rural Indians still use this. And secondly, we have more than 200 Ayurvedic colleges, graduating more than 20,000 Ayurvedic physicians every year. They're all practicing. We have Ayurvedic drugs being manufactured. It's a huge industry. I believe 6,000 crores worth of production, increasing at 15% a year. And the whole world recognizes Ayurveda today as a complementary and alternative medicine. So with all this happening, action around, how is it that you can not know anything about it? It is necessary to know about it, see what people are using around us, our society. We have to know their traditions, their customs, what they like, what they don't like. If you ignore all that, if you think you can live in an island, you are very much mistaken. So it is necessary to know. You may or may not adopt the treatment, that's a different matter. But there is no excuse for ignorance.
Why is the term Veda attached to Ayurveda?
Because Ayurveda, according to Charaka as well as Sushruta, Ayurveda originated from the Veda. There is even a mention, it is Upanga, it is a part of Veda. Panchama Veda, all these are mentioned. But this is not only for Ayurveda. All branches of knowledge in India, for example, art, music, they all originated from Gandharva Veda. That is also a Veda. So all branches of knowledge, Vedas were kind of a national repository in India. It's not only sacred religion, but all other branches of knowledge, they trace their origin to Veda. That is the context in which Ayurveda, that term came. But that term, incidentally, is never used in the Vedas. It is never used in the Buddhist texts, which came later. For the first time, you hear the mention of Ayurveda in the Mahabharata. That's where you first hear the term Ayurveda. And of course, from Charaka onwards, first century, it became a regular a term used everywhere.
But the word Ayurveda in Mahabharata and Ayurveda used by them, could there be any similarities? Or
Yeah, it is Ayurveda, they don't go into details. In Mahabharata, it only says that Ayurveda is a chikilsa, it is a way of treating sick people. That is the sense in which it is used. They don't go into details, but that term is used.
If Charaka and Sushruta have been living in Punjab and Kashi respectively as per your lectures, how it could have traveled all over the country and all the nearby countries like Japan, Thailand, Philippines, Nepal and all over, how it could have been possible? What could have been means of communication to them?
See, Ayurveda, the spread probably started only after Charaka. We had texts, we had knowledge, and most of this were migrations of people. There was no question that people were migrating from the north to the south. Plenty of evidence for it. And along with their migration, they carried their customs, they carried their traditions, they carried their religion, and they carried their type of practice of medicine also. So this spread is particularly noticeable from Buddhist times, because Buddhism at one stage spread all over India. Ashoka, we know, he sent his missionaries all over India, he sent them to Sri Lanka. So whenever these Buddhist migrants coming from the north in waves, they carried all this. That is, Buddhism, when they go to a new area, for example, they go to Kalinga, where Ashoka conquered that kingdom, that country. These are all separate countries, or they go to Kerala. And wherever they go, they carry their religion, they carry their philosophy, and they also carry Ayurveda, because that was a standard way of teaching in Buddhism. In Nalanda University, where people came from many parts of the world, they came to learn primarily Buddhism. That was the main subject of study. But a close second was Ayurveda, because that was part. There was language there, grammar, all these were taught. But Ayurveda was an important subject of study. So when these migrations happened over centuries, going to all parts of India, they carried Ayurveda. And it spread easily because the Ayurvedic Buddhists who were the leaders of Ayurveda, they never placed any restrictions. Anybody could come and learn. No restrictions. Second, they taught Sanskrit to the locals. There was no restriction on that. And thirdly, if there was something which the local people were using, a healing tradition, and this in Kerala you will see that, and they would adopt it. There was no objection to that. And of course the dominant personality of Buddha as a healer, as a master physician, that faith, all these things combined to make Ayurveda acceptable all over. That was the main agent of the spread.
Do you mean to say the civilization has been more in a refined form during the period of Buddha?
You see, Buddhist period, there are people who object to that, because Buddha never said he is preaching a new religion. He never said that. He condemned many of the pre-existing practices, like sacrificing animals. He was totally against it. Many rituals people are doing, many mantras to produce great results, to go to heaven. All these he opposed openly, many times. But he never said he is preaching a new religion. He recommended a new way of living. That is what he recommended, which is virtuous life. That is what he was recommending. And Ayurveda, that the way of healing, looking after your hygiene, these were all part of that. So I don't know whether we can call it civilization. It was really a Protestant movement. And many of the old things disappeared because rituals and animal sacrifice, you don't see it maybe here and there, but it is largely gone in India. Nobody does.
You're telling about more about the cleanliness and all that. How?
Yeah. Hygiene, use of, in fact, that when Buddha was dominant, his faith, during that time, if you read the references to medicine, they used to call it chikitsa. They never used the term Ayurveda. But in Buddhist texts, which are primarily religious texts or philosophic texts, they don't discuss anatomy, physiology and all that. But there are incidental references to health, illness and so on. From that you get a pretty good idea that many of the basic doctrines like Panchabhuta, Turdosha, etc. in Ayurveda, which are very dominant, you find all these are mentioned there, or most of them. Many of the medicinal plants we are using, they were all used at that time. Many of the surgical procedures, they were all done at that time. Buddha's physician Jivaka was a surgeon, he was a master surgeon. So what we have to realize, Buddhist, the medicine in that time was an earlier stage of Ayurveda. From Vedic medicine where it started, it evolved over 1,000 years through all these. So many things that you find fully developed in Ayurveda, you can find in an earlier form in the Buddhist time. That is the way to look at it. It's a gradual evolution.
Coming to some interesting information on Ayurveda in your lectures, I have not found cognitive informations like dealing with the brain or dealing with is there any reason for that?
In the Ayurvedic texts, they knew that brain existed, Mastishka, that was known. It was in the head, that is new. But all the consciousness, awareness, emotions, all these we associate with brain today, all these were associated with the heart in Ayurveda. In fact, Sushruta talks about 4 nerves carrying sensations from the head, vision, hearing. Dhamani is going to the head. He says that. But consciousness, everything, it is in the heart. Now this is repeatedly mentioned. So there is nothing like even epilepsy and diseases like that. There was no reference to the brain. But the surprise is, we have a system called yoga in India, Ashtanga Yoga of Patanjali, which is also as ancient as Ayurveda. Patanjali is believed to have lived in the 2nd century BC or even earlier. So that system existed. But that is all about consciousness and the brain. So they very clearly state that the level of consciousness at the level of the spinal cord, and as you go higher and higher, the level of consciousness expands, and so on. So they had a very good understanding of what we call central nervous system. But somehow that was not at all taken note of in Ayurveda. Ayurveda, consciousness is the heart. It is a puzzle. We have no answer to that. But I must say that there was one Acharya in Ayurveda, only one. That was an Acharya called Bhela. Bhela lived earlier than Charaka. We have a book, Bhela Samhita, which there are a lot of controversies about its authenticity, about its completeness, but whatever it is, that is the only text you find that mention that consciousness is located between the palate or upper palate and the top of the head. There is a reference like that. That is the only place you find in Ayurveda a reference to cognitive functions located in the head.
Given the descriptions of the so many diseases or different types of injuries for the different types of treatment, how they could have arrived on such thought if they would not have known anatomy in full? Because I don't see that they have studied anatomy, the body anatomy or human bodies, the organs.
The importance of anatomy was recognized by Charaka, by Sushruta. Sushruta specifically said a surgeon has to know anatomy through dissection. It's all mentioned. But unfortunately, the method of dissection that was recommended was highly imperfect, because Sushruta says a body of a reasonably healthy adult, not a wasting disease, not a senile person, etc., such a body should be put in a wooden box, and it is soaked in shallow water in a dark place and so on. And then when it is kind of rotted for a few days, then you take sharp leaves and you keep on scraping, or with a bamboo splinter you keep on scraping. No knife is to be used. And then each time you scrape off a layer, you see the next layer and you observe what you see there. Now this kind of anatomy, it is highly imperfect because many things have rotted away and you don't know what the muscles are, tendons. So that is the reason for the anatomy being imperfect in Ayurveda. So the reason is, in those days there must have been very severe taboos, because even touching the dead body is considered a defiling thing in India. Leave aside taking a knife and cutting it. So the objections might have been so severe. So Sushruta didn't want to violate these. So they adopted this very poor way of dissection. That left much to be desired. But incidentally, the anatomy knowledge was imperfect even in the West, not to our extent. Their anatomy was better than ours, but it was imperfect. Like Aristotle says, women, they have more teeth than men. It is easily counted, but that's what he wrote. Such imperfections are there. But that was corrected by a great Vesalius during the Renaissance time in Italy, an outstanding person in a basement, cold, no air conditioning or anything, and spending years dissecting dead bodies. And the most accurate anatomy, nothing that he missed. Smallest nerves, smallest tendons, everything is described. Now that great book, The Fabric of the Human Body, that really laid the fabric of modern medicine, if you ask me. We didn't have that. But what Sushruta and others did was, they knew this was imperfect. So they developed regional anatomy. That is, when you, suppose a man comes with a stab wound, his axilla is bleeding, so repairing and all that they would observe, muscles, tendons. So regional anatomy they picked up. That is how the whole concept of these marmas, vital spots in the body, which you should avoid when you make incision, all that he describes. So they try to supplement this imperfect anatomy from dissection by observing regional anatomy. During operations, observing wounds, or even animals, when they are being killed, they can observe a lot of similarity. So like that, they picked up regional anatomy to supplement the imperfect knowledge.
What about if a surgery and extraordinary operations are being done? What could have been the anesthetic portions of it?
We had no anesthesia. In fact, all over the world there was no anesthesia until the 19th century. So like other countries, what we did here was to give plenty of wine. So that dulls the pain sensation, but it's not an anesthetic. So what they used to do was the patient is given wine, and before the surgeon makes his incision, the strong attendants have to hold him in the desired position. I'd say difficult for us to imagine that, but it is also equally important that the surgeon, he has to be very quick. This is not only here, even like Europe, before anesthesia came, if you had to do an amputation, they had to do the amputation in 2 or 3 minutes. If you can go and see the museums, there are big knives, which we would find it difficult to use those knives. But they were experts. They would just chop off the foot or the leg in 2 or 3 minutes, because you had to minimize. You can't do anything slow. The man is conscious. So these are the bad old days.
How these people would have come across a particular herb or a particular ingredient or anything that could cure this particular disease or this particular treatment? How could they have arrived on that conclusion?
It is one of the greatest achievements of Ayurveda, this very large herbal wealth that we have. And a lot of these tips they got from shepherds, what we call folk medicine today, people living in forests, tribals. They have a lot of knowledge about medicines which are used for various common ailments. That kind of information they collected from there. Then what is prevalent in one place, something else may be prevalent in another place. So in Charaka Samhita itself, in these discussions, you will often find somebody suggesting a different type of formulation, using different medicinal plants which are common in their place. So you will find them named after them, Manibhadra or Atreya, like that. You will see medicines named after them. So it was collected to something like a national formulary. Somebody coming from Tamil Nadu, he will say, this is what we use there. Somebody coming from Maharashtra, he will say, this is what I am using. So all of them collected over hundreds of years. So that is how this large formulary we have. But it's a great achievement, no question, because after Charaka did that, we have maybe the total number of plants that we are using, what available on the earth, maybe we are using 10%. But all the rest of it, there may be great medications in that, but we have never been successful. We have never found anything, something totally new which is not mentioned there, because of this difficulty. How to prospecting, it's not easy.
You told me that Ayurveda would have traveled along with the Buddhist monks or the followers of Buddha or something across the nation, even crossing the barriers of the country and all that across the nearby countries. And is there any references that they also follow a system called Ayurveda in a different by a different name or something like that?
No, the Ayurvedic ideas you may see in other countries. But Ayurvedic practice of medicine, as far as I know, you see in Sri Lanka, you see in Tibet, they call it Tibetan medicine. There is a whole lot of Ayurveda in that. You may see it in Nepal. But other countries where Buddhism had traveled, like Cambodia or Japan or Korea and so on, there you may find Ayurvedic ideas, because these are things which happened thousands of years ago. Those countries have been influenced by other civilizations. Things have changed. So you may not see the Ayurvedic practice of medicine, as far as I know, except in these nearby countries. Other countries you will still find Ayurvedic ideas like Tridosha or Prakriti. Ideas like that you may find, leaving a footprint.
What is this Dhanvantari tradition and the importance of Sri Raja in Ayurveda?
Ayurveda has two traditions from ancient times. One is the Dhanvantari tradition, which is based in Banaras. It is surgical. The other is Atreya tradition, which is based in those days, Takshashila, which is now in Pakistan. There was a great university, a great center of medical learning. They were known after the great Acharya Atreya, medical, what we call internal medicine or general medicine. These were the two traditions. And Atreya Charaka is a descendant of that. Sushruta is a descendant of Dhanvantari tradition. What Sushruta says about Dhanvantari, there is a Kashi Raja Divodasa. That was the name of that king of Kashi, who was a great surgeon, great teacher. And when they go to him to learn medicine, He says, what do you want to learn? To the students, they say, we want to learn surgery. He says, yes, I will teach you surgery. Now that Kashi Raja Divodasa, he was so perfect as a teacher, as a surgeon, they attributed divine qualities to him. So this often we do in India. If there is a great person who seems perfect in every way, far above other human beings, we tend to think we worship him like a god. That is not, even today we do that. So therefore, Kashi Raja was given a divine status, the avatar of Dhanvantari.
In one of the chapters, extensively described on the surgical instruments used by the physicians during those times. The instruments seem to be resembling some sort of animals and birds and things like that. Is there anything important or something related to that?
These instruments are described in great detail in Sushruta. He describes 100 blunt instruments like forceps, 20 sharp instruments like knives and scissors. These are all described by him. And he says they should be made of good quality iron. They should be made by expert craftsmen. He mentions all that. So obviously there was good iron available, high quality, and also very good craftsmen who could make these. Now the surgeon is concerned with the ease of handling an instrument, the size of it, the purpose, utility. These are the things a surgeon is looking at. That obviously the craftsman gets these ideas from the surgeon. But then you have to, when you are operating, you want a particular instrument. You have to give a name to it. And you can name, nowadays we may name it after a particular company or a particular surgeon who gave the idea to identify those. But in those days, here the craftsmen, they gave a shape, animal face, lion faced, tiger faced, jackal faced, because these are known to everybody, even an attendant knows it, or bird's face. So that shows a great deal of aesthetics, because even today when you design an instrument or design a machine, for example, that design is very important today. National Institute of Design, they do this so that you buy something, you want to use it because of the aesthetics. Suppose it serves the purpose, utility, but it looks very ugly, clumsy. Nobody will want to use it. So our craftsmen were good in that. So if you look at them, each of them is a work of beauty, aesthetics. That's how it's all named after birds and animals and so on.
Given the manufacturing difficulties or coming with the technological development, advancement in those times, how could they have manufactured such a refined quality of equipment that can cut a human body without harming him or without giving side effects or something like that?
No, because craftsmanship was very advanced in India. There is no question. The instruments which are described, the purpose for which it is to be used, the craftsmen were extraordinarily good. Even today, that is one of the great achievements of India. Our craftsmen, in spite of all the adverse treatment they received over the years, but they have preserved that in India. Metal craft, wood craft. So that is one of the great achievements of India.
Ayurveda, as we all know, mostly we all think it's only with herbs, plants and things like that. But there were some references about some animals and all that in one of your lectures.
Yes.
Is it contradicting or do you think so?
No, Ayurveda uses in their materia medica or formularies, 3 types are there. One are drugs made from vegetable products. That is the bulk. 70-75% of the Ayurvedic formulations are herbal. Then there is a smaller percentage based on animals, animal products. These are more used in treating wasting diseases like tuberculosis or in enhancement of sexual potency. These are the 2 areas where you will find animal products being used more. But the exception is the animal product which are very commonly used is ghee, milk. These are extensively used. They are also animal products. And the third variety is the metals and minerals. In Ayurveda, they constitute a small percentage. But in the Siddha system in Tamil Nadu, it is an important area.
If the surgical procedure, the surgical equipment the type of treatment and all that have advanced so well during those times. Why has not been continued, and why does we just see a decline and we are just now thinking it as a history now?
Yes.
What could be the reason for decline?
And the reason for this is sociological, because you find by the 4th century, when Sushruta Samhita was redacted, already this had started, because a very important operation, the repair, plastic repair of the nose, for which India is known all over the world, that is dismissed in 3-4 verses in Sushruta Samhita. It is not an important operation described in great detail, not at all. And the lip repair, another equally important operation, it is only just one verse. So the reason, already it seems that these surgical techniques had gone out of the mainstream of Ayurveda. Ayurvedic Vaidyas were not doing these procedures, even by 4th century. And by the time of Vagpada, 6th century and so on, it had definitely gone out, like delivering complex labor. There is a dead fetus, you want to remove it, or treating a fracture, couching for a cataract, doing a plastic repair of the nose. All these procedures Ayurvedic Vaidyas were not doing. They were all done by people in castes who were branded as lower castes. Like the plastic repair of the nose was done by a Kumar caste man in Maharashtra, in Pune. So from the reports of observers who came to India, British observers, we have detailed descriptions of these, including figures and so on. Like people making steel, wood steel in Jabalpur. Again, these are lower caste men. And because of this caste hierarchy, they were given a lower position, no education, they had no education, and they learned the craft from their father. So whenever like James Franklin, he was asking the steel maker in Jabalpur, why is it he had made a furnace which looked rude, but its very dimensions are accurate inside, making steel, high quality steel. So when he asked him, why are you making it like this? Why do you have it directed like, why not like this? He would always say, that I don't know. My father taught me like this. So that brain had become completely dissociated from the heart. Now if that happens, that is the end of creativity. You cannot have any innovation. You will have refinement in the technique because you keep on doing it again and again. But you will never innovate because you cannot think. That was a great, huge mistake India made. Whatever the reason, we don't know how this happened. P.C. Ray, one of the great scientific pioneers of India, of chemistry, in his great book, History of Hindu Chemistry, he wrote more than 100 years ago. He goes into this in great detail. And finally he concludes a very moving statement. There he says, India's soil was made morally unfit for the birth of a Boyle or a Newton or a Descartes. This is what he says. And India's name was all but expunged from the science of inductive reasoning. Something like that he writes. Very severe indictment, which we deserved.
So how do you see the future of Ayurveda, and what do you think that we should do to make it aware among the masses?
No, Ayurveda is already very well known and accepted in India. There is no doubt about that. But the present question is, how do you integrate it with modern medicine, with other systems of medicine? We have several in India. Western countries do it in their way. They are also bringing traditional systems into their country. They also have some kind of integration. We have to do it differently here. But the present way we are giving a degree in integrated medicine, there are many doubts, arguments about the way we are doing. Is it correct? Is there a better way of doing? That sort of argument goes on all the time. But there are certain things which are slowly happening. One is the manufacturing of drugs. It is no longer being done in the old way. It is being done by factories. Good manufacturing practice, quality of raw materials, testing for quality, all these it is becoming mandatory now. You cannot do it otherwise. That's the only way to supply drugs for millions of people. So that is a huge change compared to tradition in modern science coming into Ayurveda. Secondly, the diagnosis. It is now more or less accepted. Many of the simple diagnostic techniques, blood tests, urine tests, X-rays, these are all being done in Ayurvedic hospitals also. No Ayurvedic physician would treat somebody coming with cough and sputum with some blood tinge in it without a chest X-ray. So these are, many of the diagnostic techniques are becoming common, it is accepted. The only area where there is a problem in integration is and concept-wise, we must recognize we cannot integrate. For example, Ayurvedic concepts like Panchabhuta or Trudosha, many of these, we should not even trying to integrate it with modern medicine. There is no need for it. In the area of practice, that is where a great deal of wisdom, experience, that is necessary, understanding. Because if it is infectious diseases, for which there are very effective antibiotics, nobody would get like a typhoid fever or a severe type of infection of any kind, pneumonia for example. Patient is very sick. Even the common people, they will take them only to a hospital. Or a fracture, somebody who is bleeding, emergencies. These are all treated by modern medicine. Everybody agrees. There is no disagreement. In fact, in Kottakkal, I have seen patients coming to the Kottakkal hospital. Many of the patients are coming on their own. They know what is good, well treated by Ayurveda. There is a kind of a community wisdom in India where they will go to the hospital. That is already there. So acute conditions, emergencies, all these modern medicine will be the choice. Common people believe like that. There is constant demand for more and more. But there is a whole class of degenerative diseases of the nervous system, of the musculoskeletal system, chronic allergy conditions. These are a very large percentage today, especially because of age. There Ayurveda has a lot to contribute, and there I hope there will be integration. It has to happen over a period of time.